This is a quick video on how to assess proper chest X-ray technique. First we'll look at rotation. We can draw a line through the midline and the medial clavicular heads and make sure we make nice symmetric 90-degree right angles. If there's any asymmetry of the clavicular heads, then there's likely rotation. Next we'll look at inspiration to make sure that the patient took an adequate deep breath. So we'll count the posterior, more horizontally aligned ribs, and we want to make sure we have about 8 to 10 ribs showing up in the lung field. Next we'll look at position and picture. So first you should know what view you have. So this is a PA view where basically the patient is facing the cassette and the X-ray beam is shooting them from the back, and the heart and the cardiothoracic structures are best analyzed in this view. Next when we look at a chest radiograph, we're actually looking at the patient, so their right side is on our left. So you want to make sure that the tech has correctly marked the correct side of the patient. So here they marked the right side. And also in a AP view, it's very helpful to know if the patient is supine, upright, or angled. So we can look at these beads in the marker that show us based on gravity where they fall. So these beads are falling lower down at the bottom of the circle, so this patient is upright. Next we'll look at a gross overview of the radiograph and make sure there's no areas that are cut out. We want to make sure we can see both costophrenic angles for full evaluation. And then next we'll look at exposure and penetration. So we want to see the spinous processes, the vertebral bodies, and intravertebral disc spaces, at least in the upper thoracic spine. Here we can see it even coming down lower down the thoracic spine, which is a great exposure. So look for another video on a quick assessment of the chest X-ray search pattern.